Our practical topic is hand washing, donning, doffing of PPE, and segregation of biomedical waste. So, at first, we should know what are the 5 movements when we should be performing hand hygiene. So, can you say something like what are the 5 movements? It is already written here though.
Before attending any patient.
Yes, before touching the patient, after touching the patient, after touching the patient's surroundings, and before doing any sterile or aseptic procedure, and after body fluid exposure risk. Okay, so we should remember the 5 moments when we should be performing hand hygiene. So what are the types of hand hygiene? It includes hand rub, hand wash, and surgical hand wash. So in hand rub, we use 70% alcohol or chlorhexidine based solutions, and in hand wash we will be using antimicrobial soaps, and for surgical hand wash we will be using 4% chlorhexidine based solutions for surgical hand wash. Okay, so the timings are important. For hand rub, we should take 30 seconds, hand wash 60 minutes, that is 60 seconds, that is 1 minute, and for surgical hand wash we will be taking 3 to 5 minutes. So what are the indications, like that is when we should be doing the hand rub, hand wash, and surgical hand wash? So in hand rub, it is indicated during routine patient care or while taking rounds in wards, because in routine patient care, when you sit in the OPD, check patient, do their physical examination, that you do in the wards also. Okay, so before touching the patient, after touching the patients. Except if your hands are visibly soiled with any body fluids like blood, at that time you should not perform hand rub. At this time you should be performing hand wash. Okay, so for hand wash, indication is this only. And also we will be doing hand wash. We are doing hand wash for in our day-to-day life, before eating, after eating, or after coming from the toilet. And surgical hand wash we will be doing before entering into the OT for doing any surgical procedure. Okay, so these are the indications, and timings are important. You should remember that. So what are the steps of hand washing? So basically there are 6 steps of hand washing. So before hand washing, we should wet our hands in water and put some antimicrobial soaps or hand wash and cover the whole hand. And now we will begin with the steps of hand wash. First step is to rub the hands palm to palm. Then rub your dorsum of one hand with the palm of other hands with our fingers interlaced. Then palm to palm with our fingers interlaced. Then rub the back of our fingers to opposing palms like this, and do this for the other hand also. Okay, after that we will be doing a rotational movement to rub our thumb and vice versa for the other hand. And lastly, we will be cleaning our tip of the fingers by doing a rotational movement over the palm of other hand like this, clockwise and anti-clockwise. Okay, and after that we will be cleaning our hands over the running water and dry our hands with a clean towel. And remember that the running tap, you will not close it with your clean hands. You will close it with the towel with which you have dried your hands. Okay, because अगर तुमने ये वही वाला हाथ टैप बंद करने के लिए यूज़ कर लिया तो फिर तो हाथ तुम्हारा कंटामिनेटेड हो गया ना, तो ये याद रखना है. फिर एयर ड्राई करना है अपने हाथ को. तो एक बार तुम चारों अपने में करके दिखाओ हैंड वॉशिंग के 6 स्टेप्स. करो करो. पहले पाम टू पाम, फिर ऐसे. इसका एक न्यूमोनिक भी है, सुमन करके, ठीक है. पहले सीधा, फिर उल्टा, फिर मुट्ठी, फिर अंगूठा, फिर नाखून. अब ये तुम्हारे याद करने के लिए, ऐसा नहीं कि एग्जामिनर के सामने जाके सुमन तो नहीं बोलोगे, तो ये तुम्हारे याद करने के लिए, बाकी करना जैसे मैंने इंग्लिश में बोला है ना, एग्जामिनर के सामने तो ऐसे ही प्रेजेंट करना है, तो तुम लोग एक बार करो सब लोग। हाँ, पहले ये वाला, फिर ये वाला, फिर ये वाला, फिर ये वाला, फिर, ठीक है। अभी steps for hand rubbing, the steps are same. Personal protective equipment, PPE. So why do we use PPE? So I think you guys know in COVID, the healthcare workers have been using this PPE. So we use mainly for our protection against infectious agents. Okay. So what are the components of PPE? Like what does it consist? Gown, mask, N95 mask, goggles or face shield, and gloves. So now we will be seeing the steps of donning and doffing. Donning and doffing क्या है? कुछ बताओ, समझ में आता है डोनिंग डॉफिंग क्या है? डोनिंग मतलब कि तुम इस पीपीई किट को तुम पहन रहे हो, और डॉफिंग मतलब सिंपल मतलब है, डोनिंग मतलब पहनना और डॉफिंग मतलब उसको उतार देना, ठीक है। तो so before donning you should remember that you should be in a donning standardized area, and you should be removing all your accessories, jewelries, your watch, mobile phones or wallet वगैरह, all these things, and you should be in your scrubs. And before starting the procedure you should do the hand hygiene steps, all the 6 steps of hand hygiene. So in this video you will be seeing he is doing all the steps of hand hygiene. Okay, now we will be wearing the first pair of gloves. Gloves था ना एक component PPE kit में. Okay, so now he will be wearing the gown. So before wearing the gown, you should examine that whether any tears are there or not, and you should select an appropriate size gown for yourself. Okay, these things you should remember before wearing the gown. Like you can see, he's looking for any tears or there are there or not. At first, you will wear the leg sleeves. And then you can see he is wearing the hand sleeves and closing the zips. And there is a flap present over the zip. After closing the zip, you will put on your flaps over the zip. Okay. Now he is wearing the shoe cover. Okay. Okay. So here in PPE we will be using the N95 mask. So you should hold it like a cup. So I don't have N95 mask right now. So you should be holding it like a cup, and suppose, and it contains 2 straps. One is the lower strap, one is the upper strap. I guess you have seen in some point of your life N95 mask. Seen na? Okay. Let's suppose this is your lower strap, this is your upper strap. So after holding it in a cup like position, you will place it in your mouth, face, and so that it should cover your mouth, nose and chin. And firstly you should be wearing the lower strap and placing it below your ears, and after that you should be wearing the upper strap and place it above your ears. Okay, see how he is wearing them. mask. Okay, so here you should remember one point that there shouldn't be any air leak out of the mask. Okay, and that you will confirm when you wear the mask. When you inhale at that time, it should get collapsed. Okay, and it confirms that you have wear the mask in a right way. Now he is wearing the hood, and you should wear it in a way so that it covers your forehead and your cheeks. Okay, now he is wearing the face shield. The face shield, you will place it over your brows, and in the back there is a screw present, and you will tighten or make it loose. That depends on you. Now lastly, he is wearing the second pair of gloves, and while wearing the second pair of gloves, you should try to pull it up to your forearm so that it covers your, as much as possible, so that it covers your sleeve cups. Okay. Okay, so now he is ready to go inside the COVID ward, and now we will be seeing the Doffing. So before Doffing, you should call any of your friend or any other nurse to observe and tell you that whether any tears or whether your gown has become soiled or not with infectious agents like patient's blood or any other infectious fluid. And if it is present, if it is soiled, then you can remove it with alcohol based wipes are there. See, he is showing that if any soiled things are there in the gown, you can remove it with alcohol wipes. Now remember, in Doffing, at each and every step you will be doing all the steps of hand hygiene. He is removing the shoe cover. So after this step, you will be performing the hand hygiene. Now he is removing his outer pair of gloves. Okay. So as I said, with each step you will be doing all the 6 steps of hand hygiene. And remember that all these components of PPE, it will go in the red colored BMW bin. Okay, these are placed. I will show you in subsequent slides. In Doffing area, there are 2 chairs placed. You can see, na? One is the clean chair, one is the dirty chair. So while removing all his clothes, all the equipments, he will be sitting in the dirty chair, and after he has removed every component, then he will be sitting in the clean chair. So before removing the mask, you will be wearing another pair of fresh gloves. And remember, while removing the face shield or removing the mask, your hand shouldn't touch your face, okay? जैसे पहना था वैसे उतारना भी है. पहले नीचे वाला पहना था ना, तो पहले नीचे वाला निकालना है, फिर ऊपर वाला निकालना है. Now he can sit on the clean chair. Now he is removing his last pair of gloves. Finally, he is performing his hand hygiene. Okay, so these are your steps for hand donning and doffing. So these are a pictorial demonstration of the steps of donning and doffing. You can take a picture if you want. Okay, protective footwear. While walking or during handling biomedical waste, there can be some sharp objects placed in the ground that can insert your legs. So you should be wearing a protective footwear so that such objects doesn't cause any harm. This is our little COVID warrior. So now coming to biomedical waste management. So we do it basically to segregate various kind of biomedical wastes. Okay, so there are basically 5 types of colored BMW bins. One is the yellow, red, white, blue and black. Among them, yellow is the cytotoxic one. Here you will be throwing your cytotoxic drugs. Okay, so now let us see in which bin what kind of waste you will throw. So in yellow we will be throwing the human anatomical waste like human tissues, organ, body parts, fetus, animal anatomical waste, soil waste, that is that items that are contaminated with blood, body fluids, cotton swabs, bags containing residual or discarded blood and blood components, discarded or expired medicines. Here you can see cytotoxic drugs, including all items contaminated with cytotoxic drugs. These are also kept in the yellow bin. You can see here the sign of C is so it means that the cytotoxic agents will go in this bin. Other chemical wastes, chemical liquid waste, discarded lining like bed sheets, mattresses, your gown, and other microbiological, biotechnology and other clinical laboratory wastes like your blood bags, lab cultures, vaccines, such things. In red bin, we will be throwing mainly plastic waste or rubber waste. Those are recyclable. Okay, so things like IV tubes, bottles, catheters, urine bags, syringes without needle. Syringe is made up of plastic, so we will throw it in red bin. And if the syringe contains the sharp needle fixed in it, then the needle will be thrown in white bin. Okay, so you remember this. And vacuumators and gloves. In white bin, we will be throwing sharps. Okay, that is metal needles, syringes fixed with needles. And in blue bin, we will be throwing the glasswares mainly, broken ampoules, medicine ampoules, and metallic body implants. Okay. In black, which things that have been the things that are not mentioned that were mentioned in your yellow, red, white and blue. Apart from those wastes, the other waste you will be throwing in the black one. And as I have already said, your cytotoxic waste will go in the yellow bin. Okay, thank you. Expired injection vial.
What is the name?
Sir, Roktim.
Figure out the name loudly.
Sir, Roktim.
And not the name.
Name of the clone tell us.
The waste.
Expired injection vial.
Tell it in a way so that your friends can also hear the.
Expired injection vial.
Where will you throw it? What is the vial made of?
Sir, glass.
So glass in which container?
It's in blue.
Throw it in. You can come. Show them. Read it out.
Syringe without a needle.
Syringe without needle. Syringe is made of plastic, na? So plastic where you will throw? Red one. Okay. Surgical needle.
Surgical.
Oi, surgical needle I said.
Needle is a sharp.
Sharp object, na? So you will throw it in.
Right.
Remember, don't say it just white. It's a leak proof, puncture proof, temper proof, translucent container.
Scalpel blade.
Scalpel blade. White.
Again, one by one.
One by one.
Repeat.
Go. Repeat.
Broken glass.
Broken glass. Blue.
Broken ampule.
What is the difference between ampule and a vial? Ampule and a vial. Which one is single use? Which one is double use? Multiple use? Okay, this will be your homework.
Catheter. আমি কি জানি ক্যাথেটার রেডে যাবে রাবার দিয়ে বানানো না ক্যাথেটার পলিশ ক্যাথেটার দেখেছিস কোন সময় প্লাসেন্টা ব্লাড সোকড গজ কটন সোয়াবস কই বলেছিলাম কটন সোয়াবস সয়েলড জিনিস কই ফেলাবি ইয়েলো
Very good.
ব্লাড ব্যাগ নাও ইয়েলো
Blood bag is an exception, okay?
That is an exception.
দো ইজ ইট আমি বলেছি না সয়েলড জিনিস সয়েল ওখানে লেখা ছিল না সয়েলড ওয়েস্টে তোর এই ব্লাড কম্পোনেন্টস তো এটা কি ব্লাড তো সয়েলড জিনিসই না তো এটাকে ইয়েলোতে ফেলাবি এই জন্য ব্লাড সোকড কটন ইয়েলো cover slip food waste food waste food waste না তোর soil হ্যাঁ black
Generating out of the patient. It is not a biomedical waste, hence it is a general waste. Okay?
syringe packet yes
Syringe packet
Saresh told you that the waste has not generated out of a
out
patient.
of a patient.
Okay.
Syringe packet.
Okay, I'll give you one example. You tell me this. Waste is not generated out of a patient. So if a patient comes with chewing gum and he throws this out, this is a waste generated out of a patient. Will this be a biomedical waste? No. So just use common sense while
Syringe packet will be in red one. Packet.
না না সিরিঞ্জ প্যাকেট ব্ল্যাকে যাইব না প্যাকেট তো প্যাকেট কালচার মিডিয়া অ্যালং উইথ প্লাস্টিক পেট্রি ডিশ প্লাস্টিক কালচার মিডিয়া পেট্রি ডিশ প্লাস্টিক দিয়ে বানানো হয় না হ্যাঁ গজ আচ্ছা গজ মানে বুঝছস নাকি গজ
ওই যে ব্লাড যে ডিসকার্ড করা হয়
না 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 তুই ড্রেসিংয়ের লেগা ইউজ করস দেখছস নি কোনো সময় গজ হ তো ওইটা লাইনিং না কই ফেলাইবি
gauze is made up of
লাইনিং
linen.
কটন ভিতরে কটন থাকে তারপর লাইনিং দিয়ে এটা র্যাপ করা থাকে আর কি বুঝছস তো কটন হোক লাইনিং হোক সবই তো ইয়েলোতে যাব
Gauze is a biodegradable.
Biodegradable. So it will go to yellow.
Yeah, always. Good.
metal implant,
Metal implants. Implants, I think, white.
blue. Last एक कुछ लाऊं. Glass and metal implants.
Remember, microbiology is a science of exceptions.
Metal implants is metal. Normally metal goes into white, but it is not sharp.
Yes, if any sharp metal, then it will go in white. Slides. Glass. Blue. Glass blue था ना?
Then broken glass.
Broken glass हो जाई हो. Glass blue ते जाइबो. Catheter packet. Black. Good. Needle.
Very good.
Lancet.
Lancet.
Lens. হ্যাঁ, lancet বুঝছস নাকি?
Lancet means plastic and
No, what is a lancet? What is it used for?
so picky.
হ্যাঁ.
Very good.
So,
So can you separate the pin from the handle?
no, sir.
No. So it's a sharp object.
Sharp.
Very good.
Paper cup.
Like
Very good.
Anatomical waste. Too easy.
Very good.
Expired drugs.
cytotoxic.